Hi, I'm Dr. Tod Howard with South Lake Spine and Injury. One of the most common questions I get in my Groveland chiropractic office is simply, what's wrong with my back? Well, that's what I'm going to answer for you in this video. The most common spinal condition chiropractors treat is something called segmental dysfunction. This can be caused by injuries, poor ergonomics, poor posture. Sometimes it's even just bad luck at the gene pool. We've moved over to this model of the lower back, and as you can see, I've already numbered it. And you've got your sacrum, L5, L4, L3, and L2. And what I want you to do is I want you to look at the movement between sacrum and L5. Look at that movement. That's a lot of movement. Now, what I want you to do now is I want you to take a look at the movement between these two, L4 and L5. Not near as much. And as you can tell, that's going to be a problem. And your body's going to react in a number of different ways. One of the first things that's going to happen is you're going to get tight muscles and even some tenderness. Sometimes they can be so tight and tender, it's hard to move. The pain and spasm are not necessarily limited to the spine. As you can see, it can travel up the spine. It can travel down the butt. It can move even further down the leg. So there's just because you have an area or a problem in a specific area doesn't mean that you won't find some radicular pain. The next thing we're going to see is the inflammatory process. And if this is not treated, this is where things can really go downhill in a hurry. What we're looking at here is we're looking at a facet. This area right here is just one of the back joints on a vertebra. And we've got a cartilage in here, and then as we go over, we'll see we've got a capsule. During an injury, you'll see that this gets injured and we have some tearing in there, and it's going to build up some scar tissue, and because of that inflammatory process, these ligaments will actually shrink a little bit, and it's going to reduce that range of motion. And once that starts to happen and this stuff starts to build up, it can permanently limit the movement of that vertebral segment, and that becomes a major issue. And you can see as this thing starts to move, it's going to start to get red and irritated. And once it does that and it gets stuck like that, now we've got some major issues. Over time, the spasms and inflammatory changes are going to alter the biomechanics of the spine. As we look down in here, you'll see how those changes begin. And the best way to explain this is it's kind of like a misaligned tire on a car. It's going to cause it to it's going to drive poorly, and it's going to make the tires wear out faster. And that's basically what's happening to the spine. And this degeneration problem or arthritis is eventually going to cause chronic pain and possibly some serious nerve issues. Now you're probably wondering if you've got one of these segmental dysfunctions. If the pain in your back lasts more than about 3 to 4 days, you really need to get it checked. There's no reason to let a small problem become a big one. Give us a call. You can visit our website, southlakespine.com. You can make an appointment, fill out new patient paperwork, get more information, or even request a free consultation with me, Dr. Howard. We want to thank 3D Practice for the wonderful graphics. And if you like our blog, please share it with your friends and give us a like. Thanks. Have a great day.